Small cell lung cancer. Everyone meet Dave. Dave is a 47-year-old man who has been a chronic smoker for 23 years, averaging 30 cigarettes a day. Recently, his coworkers have commented on his wheezing and shortness of breath, so he consults a doctor. After visiting with his doctor, Dave is diagnosed with bronchitis. Shortly after, he develops a persistent cough and bronchitis again, so he visits his doctor. His doctor finds a tumor in the central part of his lung and diagnoses Dave with small cell carcinoma.
There are several risk factors associated with lung cancer. The number one risk factor for small cell lung cancer is smoking. At least 60 of the chemicals in cigarette smoke cause cancer. The main risk factor among non-smokers is secondhand smoke. Secondhand smoke contains the same chemicals as smoke that is actively inhaled. Occupational hazards are also a common risk factor. This includes exposure to radon, arsenic, chromium, nickel, ionizing radiation, coal products, mustard gas, and vinyl chloride. The major function of the lungs is to supply the body with oxygen and dispose of carbon dioxide, which helps to regulate acid-base balance. In the lungs, the bronchi split into bronchioles, which connect to the alveoli, which are spongy, air-filled sacs. The alveoli are surrounded by capillaries that connect to the heart.
When inspiration occurs, oxygen diffuses from the alveoli into the capillaries and is then carried to the heart by the pulmonary veins. Carbon dioxide diffuses from the blood back into the alveoli to be exhaled as waste.
When the external intercostals and diaphragm contract, the lungs expand, which causes the pressure in the lungs to become slightly negative in relation to the atmospheric pressure. As a result, the air moves from the atmosphere into the lungs as the pressure is higher in the atmosphere than in the lungs. When expiring, the muscles relax and lung volume decreases, resulting in the intrapulmonary pressure becoming slightly positive in relation to the atmospheric pressure. As a result, air leaves the lungs.
Small cell lung cancer is characterized by a distinctive cell type of small and round to oval-shaped cells that are approximately the same size as a lymphocyte. These cells grow in clusters that exhibit neither granular nor squamous organization. Small cell lung cancer arises in the peribronchial location and infiltrates the bronchial submucosa. Cancer cells originate in the epithelial cells in the lung lining due to genetic mutations, more specifically a mutation in the tumor suppressor gene TP53, and replicate uncontrollably, causing tumors to form. These tumors occupy a significant amount of space, which make gas exchange difficult. Small cell lung cancers are highly malignant, tend to infiltrate widely, and metastasize early on in the disease. This form of cancer has the strongest association with smoking and is rarely seen in someone who has never smoked. Because these tumors grow rapidly and tend to metastasize early on and widely, this type of carcinoma has the worst prognosis of all lung cancer. Some of the main symptoms associated with small cell lung cancer are wheezing, difficulty breathing, weight loss and fatigue, and hemoptysis. Wheezing is caused by the obstruction of airflow associated with the cancerous masses in the bronchioles and surrounding lung tissue. Tumor-causing blockages can cause an accumulation of bacteria, which can lead to infection. The body's natural immune response causes swelling or increased fluid to site of infection. This compresses the tissue into the airway, which leads to the symptom of difficulty breathing. Energy is allocated to attacking cancerous cells, which leads to weight loss and fatigue. Hemoptysis, or coughing up blood, is caused by irritation in the bronchioles caused by the cancerous tumor. Small cell lung cancer and the three key concepts. Homeostasis is disturbed due to impaired gas exchange and the inability to properly function and ventilate the lungs. TP53, which is a tumor suppressor gene, is a protein which can become mutated, causing this disease. Lastly, cancerous tumors invade the cell membrane of the epithelium in the bronchiole.
Shortly after Dave was diagnosed with small cell lung cancer, it had spread to his brain and bone with no option of treatment. Dave lived a happy life and passed away 2 months later.
Created using Powtoon.